Today's topic is Takayasu Arteritis. So it is a granulomatous vasculitis of medium and large sized arteries. So there will be manifestations of ocular disturbances, weakening of pulses in upper extremities. First, a radial pulse. So there is age distribution. So individuals with less than 50 years of age, it is called as Takayasu arteritis. In individuals age with more than 50 years, it is called as giant cell arteritis or also called as temporal arteritis. So both have same clinical features and histology. Etiology is likely autoimmune causes, and we will see now about clinical features. So there will be initial and later clinical features. Initial clinical features are fatigue, weight loss, fever. Later vascular symptoms will appear. So there will be decrease in blood pressure, weaker pulses in upper extremities, ocular disturbances like visual defects, retinal hemorrhage, and total blindness. And at last, there will be neurological deficits also. So, weaker pulses in upper extremities is a major clinical feature. Now, we will see complications. So, there are complications with respect to the artery involved. So, first, if there is distal aorta involved, there will be claudication of legs. What is meant by claudication? Pain, fatigue, numbness in the legs during work. So if there is pulmonary artery involvement, there will be pulmonary hypertension. If there is renal artery involvement, there will be systemic hypertension. And the most important one, if there is narrowing of coronary ostia, there will be myocardial infarction, which is a severe case. So when there is aortic root involvement, there will be dilation and aortic valve insufficiency. Now morphology. So in morphology, the first one is to notice about hyperplasia of tunica intima. So irregular thickening of the vessel with hyperplasia of tunica intima. So the great vessel lumens will be narrow and they will be obliterated, and this is the major reason for weakening of pulses. So hence it is also called as pulseless disease. Takayasu arteritis is also called as pulseless disease. So mainly Takayasu arteritis involves aortic arch. And now we'll see about histology. So these are diagrams of H stain and silver stain. Silver stain is a special stain which is used to highlight the elastic fibers. So it will highlight the elastic fibers with black color. You can see here now. This is clearly visible internal elastic lamina. So you can see here there is hyperplasia of tunica intima. So this is the lumen. So this will be the endothelium, and this is internal elastic lamina. So you can see irregularity over here of tunica intima. Here it is narrow, here it is narrow, and here it is broad. So this is due to inflammation of hyperplasia of tunica intima. So this is H and stain. So you can see obliteration of the lumen, which will cause the complications in further. So first thing to notice lumen. So first thing is hyperplasia of tunica intima. As it is in the name, it suggests vasculitis. Itis means inflammation of vessel. So inflammatory cells in tunica media and adventitia. So inflammatory cells present here are mononuclear. So sometimes we can see giant cells also, and there is medial necrosis also. So this is about Takayasu arteritis.